Waddell, and I'm from Alabama. I'm a flight nurse, pediatric neonate transport. We do helicopter, jet, and ground transports for neonates and pediatrics. I've been doing this for 18 years. And then I had worked in the pediatric ICU 4 years prior to that.
Wow, that's very, very cool resume that you built yourself there.
Well, thank you.
You're welcome. So I know you shared a little bit about what exactly happened. I know you had an injury when you were younger. What was the story?
So I was 10. We were out riding our bikes and we stopped by the neighbors because they were working on a fence, and I decided to stop and help for a little while. And then I ended up getting my coach string caught in a PTO shaft of an auger that is used to drill post holes. It goes on the back of a tractor. The PTO shaft spins significantly faster than the actual drill part that is drilling the holes. And it caught my coach string in it and pulled me onto the PTO shaft part. I didn't actually get into the drill, but I did. The spinning from the PTO shaft was enough to detach my left arm. And I was knocked out for a few seconds, and I woke up on the ground missing all my clothes except for my tennis shoes and my left arm.
Oh my gosh. Oh my gosh.
So that's a nutshell on what happened.
That's quite the story though. So what was your recovery like?
So that night they took me to the hospital. This was like pre-911 in our area. So they drove me in POV to the hospital. My mom and grandmother followed behind. They were kind enough to pick up my arm for me because I had left it behind. And then they got me to the hospital, and they flew me to a bigger hospital. That was the night of my first helicopter ride. This was also in 1987. So it's amazing to me that they were able to reattach my arm that night in 1987. Whereas still today, there's some to keep their limbs and stuff, and it functions, which is even more impressive in my opinion.
Yeah, no, very impressive in my opinion. Was it kept on ice, your arm, or was it?
No, they did not put it on ice. They literally just picked it up off the side of the road on the way to the hospital. And phantom pains and phantom sensations are a real thing, because I felt like I was opening and closing my hand all the way to the hospital. Like, I remember all of this. Oh. And so later on, a few months later, I asked my mom if my fingers were moving in the other car, because it felt like I was opening and closing my hand. And she said no, and I was very disappointed.
Oh, no.
That would have been an even cooler story to tell.
Way cooler. That would have been a whole other discussion.
Right?
A life of its own. Oh my God. That is crazy. So that's super. What a cool story. I mean, it's cool because you're here, obviously. Like, it's
right.
I mean, it's a very fascinating story to hear. So was that what kind of interested you in getting into healthcare? Was that a motivating factor for you, or?
Eventually, yes. Being a 10-year-old kid, and I was in the ICU for like 5 days, and I spent a total of 2 weeks in the hospital initially. Okay. And I was in the ICU for like 5 days, and that was back in the days where also I was in an adult facility. So, visitation was 15 minutes every 4 hours. And so, and then, during my whole hospital stay, there's a lot of things that hurt that I was 10, I didn't really understand. And so initially I did not want anything to do with healthcare, because in my opinion, they just hurt people. And so I didn't really understand all of that. But as I got older, I realized, they weren't trying to hurt me. They were helping me. It was just happened to be painful. Yeah. So then I was like, maybe I will kind of check into this whole health sciences thing. And I started at EMS and worked with a volunteer fire department for a little while. And then went on into nursing school shortly after high school. So,
yeah, very cool. That's a pretty cool roundabout way to get there. Makes sense though. As a kid, you attribute the hospital. I definitely know how that goes, to a negative experience, and then as you get older, you're like, oh, okay, so they were doing this for a purpose, not just to torture me.
Right. Yeah. It wasn't just a torture chamber. They actually had a reason for doing it.
So you have full functioning in your arm then?
Mostly, yeah. I'll show you. If you see. So this is. Sorry, I've been doing some projects around the house and I'm all scratched up. So it came off mid-humerus.
Okay.
They did have to shorten it about 1.5 inches just for debridement purposes because it kind of twisted it off. So I had some tears and then there was a lot of dirt and debris. And you can see, like back in the day, you know, the fasciotomy scars are different now, but back in the day, there were still these wide fasciotomy scars here and here. And this one actually goes all the way up under my palm of my hand.
Okay.
But yeah, it functions and like I have good grip and you know, it's not quite like the other, but it works.
I mean, but the fact, like you said, and 87, you said 1987?
1987, April the 6th, 1987.
That is, you don't hear of that. You feel like even now. Right. So that is
crazy.
Yes. Do you share? So I know you said you work with pediatrics. Do you share your story with family and your patient?
If they ask, I do. I don't volunteer it. But if they ask something, then sure, I'll tell them. I don't mind talking about it, and I never mind anyone asking.
Yeah.
At all. I would much rather you ask than just kind of stare. It's fine with me. But you know, I've had patients to ask. I've had family, and a lot of times I'll make up a story first on something else, you know, funnier that or
than your actual story.
Right? But it gets boring after this long, like 30-something years.
Yeah.
Story.
Yeah, that just gets boring for you, nobody else.
So I'll make up new ones. You know, like running with scissors, whatever.
Yeah, there you go. At least has a lesson with it.
Right?
A lesson.
But yeah, I'll tell them if they ask. And then I've had family members with other family members that have a defect in their hand or something, you know, not even patients of mine that I've taken care of. And they'll ask, you know, what advice I could give them for, you know, their family member or whatever.
Oh, yeah.
My advice is always don't ever underestimate what their abilities are.
Yeah.
Just because we have to do things a little differently than everybody else doesn't mean we can't do them. So
I 100% agree with you. It's pretty much been the life motto of mine as well.
I forgot to mention that my left hand was my dominant hand, so I had to.
Oh, really?
Yeah.
Oh my gosh! If it's
everybody's always like, "Oh, at least it was your left hand." I was like, "Yeah, but I was left-handed." Yeah, I started writing before I ever left the hospital. The first time, just practicing with my right hand. Yeah. It took me about 1.5 years to get any movement after my nerve grafts in my left hand. Okay. And it was just like a twitch in my thumb and my index finger. Those were the first two that started moving, and it was literally just like a twitch. Like I could see it, but not everybody could see it, kind of thing.
As far as when you share your stories with your patients or family, how do they respond to it?
Yeah, they don't expect the answer that's about to come out when they ask me what happened. Most of the time, they're get a little big-eyed, but yeah, everybody's been super positive. They're pretty, impressed that I got it back as well. So
yeah. Any recommendations that you would have for anybody that might be watching this that has any similar, obviously not a similar story, but a similar accommodation that they might need in their practice?
Right. So in my opinion, everybody has a crutch that could hold them back if they let it, and like the metaphorical crutch where, I could wallow around and, be all poor pitiful me because I lost my dominant hand. But that's not me. I'm not into that. But so my advice would be to don't let whatever you have be your crutch to hold you back. Let it be your fuel to your fire to move you forward and to chase your dreams. You don't, nobody but you knows what you can do, and you don't know what you can do until you try. Like my biggest nemesis in nursing school was sterile gloves.
Okay.
Because I had to do it differently than everybody else did. Like I had to figure out a way that I could do it and remain sterile.
Yes.
But I knew for a fact that it wasn't going to be like everyone else was trying to do it, right? Because I always, when I talk to high school students in the allied health sciences classes, and so I always tell them, you can't change the standards because you have to do it differently. So even if you have to do it differently, you still have to fit within the standards that are set.
Yes.
For like a sterile procedure or what have you. And so I practiced every day for 2 weeks. Like we had a practice set of sterile gloves that they gave us, so we could take home and practice. I repowdered those things like probably 30 times in those 2 weeks because I was practicing so much. But I finally got it down where I could do it. It was modified from how able-handed people do it, but it was still a sterile procedure. So I didn't break the standards. I just had to do it a little bit differently. So, there's always workarounds if you just, sit and think about it for a little while, and that's what I end up having to do.
Yes.
I've always said, there's nothing I can't do. I'm just going to probably have to do it differently than everybody else would go about it, but I've yet to find anything that I absolutely can't do. So.
Yeah, it shows what an inspiration. It's so cool to hear your story too. No, thank you. I mean, I've just really actually enjoyed this a lot. What would be your favorite part of your job?
I know it's very cliche to say, but making that difference, whether it be, sometimes there's just not anything we can do for the patient. We can try as hard as we can, but unfortunately, there's just sometimes we can't do anything. But we can give comfort to that family and know that we've done everything we can do. And so, best case scenarios, we make a huge difference. We get this patient where they need to go and everything works out great. And I play a small part in that. And, we're kind of all just cogs in the wheel and everybody has their part to play. And so, I try to play my part to the best of my abilities every time, whether it be giving comfort to the patient, whether it be giving comfort to the family, not only just with my, nursing skills or the skills that I have to get them to where they need to go, but the all encompassing where I know it's a big ask for these parents to let me take their patient by themselves to another hospital. I totally get that's a huge ask. I'm asking them to trust a complete stranger, and I don't take that lightly. And I've been that scared kid that has to go by themselves on a helicopter or, on a different mode of transport. So I get that. So I try to, do not just focus on the nursing aspect of it, but I try to focus on the emotional aspect of it, the family aspect of it, that I want this patient, if they're awake, I want them to be comfortable. There's been many times where I've held hands instead of charting all the way back. I mean, I didn't have any nursey things to do, but other than charting, but, I'll hold their hand till we get back to wherever we're going, if that's what they want. I can spend 10 minutes after we get back charting. That's fine. It's no big deal. But so I like to try to make a difference, even small gestures. If I can make a difference and I can make this family feel comfortable that I'm leaving with their patient by themselves, then I feel like I've done my job.
Myra, they're lucky to have you taking care of them and their family members. Seriously, you obviously are very passionate about what you do, and it shows.
Well, thank you.
Thank you.